Cathaoirleach, thank you for the opportunity to update the House on the COVID-19 vaccine programme. Like so much of our nation's response to the pandemic, the vaccine programme is testament to the way as a nation Ireland has come together to show the best of what the country can achieve. One of the most powerful demonstrations of how the pandemic has brought out the best is in the development of vaccines against COVID-19. Private sector innovation has merged with public sector investment and support to ensure the speedy development of safe and effective vaccines. This is particularly evident in the procurement process devised by the European Commission. This allows Member States to access a portfolio of candidate vaccines against COVID-19. Through the leveraging of the EU's Emergency Support Instrument, funding has been provided to vaccine manufacturers to meet, in some instances, the cost of production for a vaccine. As of the 24th of January, which was last Sunday, 143,000 doses of vaccine have been administered to our frontline healthcare workers and in long-term care facilities. This equates to nearly 3% of the population. 66,000 doses were administered to the residents and staff of long-term residential care facilities. And
sorry to interrupt you. Is there a copy of the speech?
There is.
It's been circulated, or is it coming? Or?
It's here somewhere.
It's here somewhere. Yeah. Maybe we could find it. Yeah. Thank you. Thanks, Minister. Sorry for interrupting.
66,000 doses were administered to the residents and staff of long-term residential care facilities, and 77,000 doses to frontline healthcare workers. The HSE also commenced administration of the second dose of the vaccine last week in 27 nursing homes and in hospital groups. That work of administering second doses is being significantly stepped up this week. The presence of COVID-19 in a number of care facilities continues to be a challenge. This means that some residents and staff could not be vaccinated. Due to outbreaks of COVID-19, 4 nursing homes out of a total of 589 were not included in the first series of vaccinations based on public health assessments. And in some others, it was not possible to vaccinate all residents or staff due to their COVID status. Those who were unable to receive a first dose will be vaccinated once it's deemed safe to do so. It's important that all stakeholders are aware of how dynamic the situation is with regard to supply chains, and that Ireland has to employ an agile plan to react to such changes. For example, some adjustments may be necessary to the original target doses being administered in March to take account of AstraZeneca's recent announcement regarding reduced delivery, lower than what was expected from AstraZeneca. Acting on behalf of Member States, the European Commission has negotiated 6 advance purchase agreements with a range of vaccine suppliers to date. In total, between initial volumes procured and additional opt-ins, Ireland has advance purchased over 14 million doses of vaccine. I'd like to acknowledge, Las Ceann Comhairle, the major efforts taken by the Commission in developing the initiative and bringing it to fruition. There are currently 2 vaccines in receipt of conditional market authorisation from the European Commission and the European Medicines Agency. These vaccines, which are produced by Pfizer, BioNTech and by Moderna, have been reviewed by the European Medicines Agency, providing significant assurance that they're both safe and effective. These vaccines are currently being administered as part of Ireland's vaccination programme. Reduction in the quantity of Pfizer-BioNTech vaccine supplies across the EU for 1 week was indeed a challenge. These reductions in supply were required to allow the company to make necessary changes to expand its production. The increased level of production capacity will be beneficial for Member States, including for Ireland. A third vaccine supplier, AstraZeneca, submitted its application for conditional market authorisation to the European Medicines Agency and may receive approval from the Commission as early as tomorrow. Obviously, we're watching that very carefully. Ireland has secured 3.3 million doses of this vaccine, and it's envisaged that its availability will be crucial to vaccinations to be administered by pharmacists and GPs in our communities. Recently, AstraZeneca advised that it will be unable to meet its initial delivery commitments once it has, or indeed if it receives, conditional market authorisation. I'm advised that this is due to difficulties arising at one of its manufacturing plants in Belgium. Negotiations with the company are continuing, and at a meeting last night, the company was still not in a position to provide clarities on the full deliveries after the middle of March. While it's anticipated that this should not impact on a start date for the rollout of the vaccination programme to the over 70s living in the community, its impact upon the pace of vaccinations is still difficult to gauge at present. It's important to note that funding was provided by the Commission through leveraging its emergency support instrument to facilitate production of vaccines on behalf of Member States. This instrument is ultimately funded by the Member States themselves. AstraZeneca's vaccine has been delivered in other countries outside the EU. The Commission, understandably, wishes to find out how the funds that it has provided to AstraZeneca were used, given the absence of agreed doses of the vaccine being delivered. Greater control measures to monitor the export of vaccines and associated transparency measures may be the best mechanism to facilitate this process, and it's something that the Commission is actively engaged with the company on. A feature of the vaccination programme is that the administration of vaccines here in Ireland will be limited only by supply. While vaccines are currently being administered to cohorts 1 and 2, that's long-term residential care and frontline healthcare workers, the intention is to provide access to free vaccination for all adults. The vaccination programme conducted by the HSE exceeds expectations and is a testament to the commitment of all involved. I'd like to finish, Cathaoirleach, by acknowledging the work of everyone involved in the vaccination programme. It includes our vaccination teams. These are school vaccination teams, community vaccination teams, peer-to-peer hospital vaccination teams. It includes our GPs, practice nurses and pharmacists who will be involved in the rollout. It includes the trainers right across the country who have trained many thousands of vaccinators and will be training many thousands more. It includes the Defence Forces who are working with us around the country. It includes the National Ambulance Service who have been quite extraordinary, both in terms of the vaccinations and right across the response to COVID. It includes the nursing home staff, both the nursing home nurses themselves and the administrative staff who've been really important in making sure we were able to get into the nursing homes as quickly as was done. And it includes another group who don't get much attention and who aren't seen, because they're the women and men working behind the front line. But there's a large number of people working behind the front lines in logistics, in management, in IT, in administration, and the work that has been going on, both with some of these frontline groups and those behind the front line, Cathaoirleach, has been amazing. They've stepped up again and again and again. They're working night and day, they're working weekends to make sure that the vaccination programme keeps moving and keeps getting out to the most vulnerable and to those who protect the most vulnerable. And I just want to finish with a word of thanks to all of them, because not only are they all stepping up and doing this incredible work, they're doing it after what's been a very, very difficult year in healthcare, where they and their colleagues have been asked repeatedly again and again to step up and have done so. And I just want to finish by acknowledging them, acknowledging their work and their commitment, and acknowledging ultimately that work, that commitment and that professionalism is what is meaning we are getting to protect our frontline healthcare workers, getting to protect those who are most vulnerable, very shortly moving on to protect those over the age of 70 in the community. And I just want to thank them all for that. Thank you.